So hello, everyone. Welcome to this breakout session, which is about the Mothers and Babies course. I am Alin Barrera, and I have the pleasure of co-presenting about the Mothers and Babies course with David. Oops, sorry about that. I should also say that I am the room monitor, so I'm doing a little bit of double task here. So give me 1 second to allow others to enter.
Oh, don't worry, Alin, I'll start. I've been letting people in as they come in.
Okay, perfect. I
can co-host with you.
Got it. Thank you. I removed the security. So welcome to the Mothers and Babies course. I'm going to be talking about and introducing what it is. Because there's just David and I here today, we do want to invite and encourage you all to enter your questions or to ask questions, but feel free to enter them into the chat. Or hold them until each of our sections are done, and we'll definitely have some time to answer those. Unless you have a burning question, then we'll definitely pause to do that. Okay. So this is us, and we're really excited to be here to share with you the Mothers and Babies course. So first of all, let me just introduce what it is for those of you who maybe have not heard of the Mothers and Babies course. It is a behavioral health intervention aimed and designed to improve maternal mental health and parent functioning. The original Mothers and Babies course, as many of the iterations as well, was designed to prevent and to treat perinatal depression. Our goal really with the Mothers and Babies course is to reduce the incidence or the onset of postpartum depression, in particular amongst high-risk women, and to teach them different skills based on cognitive behavioral therapy and social learning therapy, how to manage changes in their mood during and after pregnancy. Birthing persons who have mild to moderate depressive symptoms or elevated stress or anxiety can benefit from the Mothers and Babies course. It can also be implemented universally as a stress management course, which is how we often do present the Mothers and Babies course, partially due to stigma, as well as the variability in the experiences that birthing individuals have around their emotions and what they're experiencing currently in their life. And even though the Mothers and Babies course was designed initially as a prevention intervention, it can also be delivered and implemented as a treatment intervention. We just want to make sure that some of the more acute clinical presentations are addressed with more targeted care for those who might be more severely depressed or anxious. I'll share with you some about the conceptual background. So I already mentioned that the Mothers and Babies course is based on a cognitive behavioral therapy or cognitive behavioral theory approach. And this is what we use really as the core skills that we're teaching. As you'll see in the coming slides, there are different modules or areas that we target with the Mothers and Babies course, but in each one of those areas, we are constantly coming back to cognitive behavioral therapy principles of addressing cognitions, engaging in behaviors that are pleasant or meaningful, engaging with other individuals. So interpersonal relationships is key, and all of this with the intention or the goal to improve or reduce negative consequences of depression, anxiety, and stress. Ricardo Munoz is one of the original creators of the Mothers and Babies course, along with Mimi Lay and others. And as part of his own theoretical approach, or one of the models that he has really talked about a lot, is what he calls the healthy management of reality. And what the healthy management of reality really talks about is really thinking about our internal and our external reality that together comprise our personal reality. And by internal reality, what we're really talking about is the things of our mind, the things that other people cannot see, our subjective environment, our thoughts, our beliefs, our judgments, our memories. These are things that are internal to us. And then related to that is what's in our external reality. So observable, measurable things. Sometimes that might be the manifestation of internal experiences. So one example of that might be, we may be having a negative thought about our role as new parents. And consequently, the external reality aspect of that is that we may isolate or not engage with others or talk to others. So the idea here is that by being aware of what our internal reality is, and by being aware of what our external reality is, we can then begin to make changes in both of those realities in order to live a healthier and hopefully happier life. And to do that, we really begin to apply some of the principles of cognitive behavioral therapy. That's a photo of Ricardo Munoz, in case you haven't seen him, but just so you know who we're talking about here. And so the Mothers and Babies course has as a core theoretical approach this sort of managing your own personal reality. Part of the impetus for this really stemmed out of some of the work that he was doing at that time, and that many of us have done at a public sector hospital, where we were working with high-risk populations who often didn't have a lot of control or ability to change some of their high-stress situations. So whether that was things in their external reality that were difficult to change, or things about their histories or their past lived experiences that were difficult to change or to modify. And so one way to begin to affect that was to really begin to think about where are the areas of one's life, both internal and externally, can they make changes, and in order to have a better mood. And of those changes, how will they make those changes? And so that's where we use CBT principles to really begin to help them identify those areas, and then also to implement some changes in their daily lives. So I'll just pause there just to say that another aspect of the Mothers and Babies course that's integrated throughout the different sections of it is really thinking about social learning theory and attachment. So in addition to teaching new parents, and in particular birthing individuals, ways in which they can begin to affect changes in their way that they're thinking and the things that they're doing, it's also a way to begin to model for their children. And that's really core to the prevention aspect of it and the targeting of pregnant individuals. The idea is that during the phase of pregnancy that they can begin to not only practice and learn how to implement these skills, but that they can also begin to model them for when their other children are growing up or when their newborn baby is born. And so that is the part where, you know, we really feel like modeling and practice plays a really key role in the Mothers and Babies course. And as well as, you know, as you begin to engage more with your children, with your newborn baby in ways that are healthier or more positive for you as the birthing individual, they will then begin to learn more adaptive ways of managing changes in their own mood. As we know that newborn babies change a lot and have a lot of different emotions happening, which we often hear as crying and being fussy. But as they begin to get older, the idea is that they will see us as parents modeling these behaviors, and they too will learn how to model those behaviors as part of their own journey. The Mothers and Babies original course or intervention was designed as a 12-week group that met for about 2 hours and included booster sessions in the postpartum period. Since then, the group format has been adapted from 12 to 8 and to 6 weeks. As you might imagine, it was very challenging to invite and have perinatal individuals come to a 2-hour group on a weekly basis. It was just, you know, logistically not very practical. And so Mimi Lay and her work reduced it down to 8 and 6 weeks. We've also had adaptations where we have integrated it into home visitation programs and designed it to be on a one-on-one basis and briefer formats. And then also part of my own contributions to the development of the Mothers and Babies work is really thinking about ways to make it more accessible using digital tools or using simple technologies of the internet and text messaging. So I'll go through and talk about some of the differences and similarities of all of these different types of the Mothers and Babies course. So regardless of which approach might fit your community or your interest, for most of the different modalities of the Mothers and Babies course, we have a participant manual and we have an instructor manual. The participant manual is really designed for users or birthing individuals or new moms to use it as part of a group format or an in-person format. The participant manual is really nice in the sense that it includes a lot of graphics, very simple ideas of what is going to be covered in that particular session. The drawings are really helpful for some of our low literacy patients or clients who are using the Mothers and Babies course, and it really just provides a structure for each of the different sessions. When we are delivering this in person, we often, or even digitally, virtually through groups, like Zoom groups, for example, we still give each participant a manual for them to follow along. And the best way really to think of the manuals is to think of them like a menu or a toolkit, or if you've been around long enough, like a Fodor's travel guide, there's a lot to cover in each session, and it's impossible to cover it all. But it gives you a lot of different options for what you might want to cover based on the characteristics of the group members. As I mentioned, we have an instructor's manual, and these are really great for those who are going to be facilitating the groups because it really breaks it down in a lot of detail, probably in more detail than you care to see. It can be a little bit overwhelming. But the whole point of the manuals really is that we really wanted other people to be able to access these materials and be able to read through the instructions and be able to implement it in their communities. So all of these materials are available for free download online. And I believe at the end of this slide deck, we have the links. If not, I can share them in the chat. But the goal for the instructor's manual is to provide a session by session, even with scripts, detailed outline of what is to be covered in each session. And it's really up to the facilitators to kind of decide what they're going to cover and how much detail, again, based on the participants that are forming part of the group or the client that you are working with individually. Within the instructor's manual, there are also fidelity forms in the event that facilitators want to be able to rate and evaluate the effectiveness of their implementation of the Mothers and Babies group, or how users or participants and clients are receiving the content of the Mothers and Babies. So if this is something that you're interested in implementing, you definitely want to look at the instructor's manual, knowing that you won't be able to cover everything, but it gives you a lot of really nice guidelines and instructions on what to say, how to say it, how long each aspect of each session takes, and so forth. I'll go through each of the different modalities and adaptations of the Mothers and Babies and present some of the evidence for each one. So the original Mothers and Babies course was a 12-week course designed as a group with 4 booster sessions during the first year postpartum, which really served to reinforce some of the constructs that the participants in the group who usually completed the group during pregnancy, you can revisit and apply them now that they're new moms. This particular version has been translated into several languages, and in fact, almost every version is available at minimum in English and in Spanish. But we sometimes get requests from other groups, clinics, in different countries to translate the materials, which we fully encourage. And so a lot of these are available online should you work with patient populations that speak those languages. If you're interested in seeing some of the work of Ricardo Munoz, who's now at Palo Alto University, which is where I'm at, or if you're interested in accessing the 12-week version, this is the website where you can access some of those materials as well as some other depression manuals that he has been involved in. When we looked at the data for the first randomized controlled trial of the 12-week group session that was conducted at San Francisco General Hospital, and that initial study looked at whether we could prevent postpartum depression in pregnant Latinas who are at high risk for postpartum depression. And what we found is that the women who were, what they found is that the women who were randomized to the Mothers and Babies course had a lower incidence of postpartum depression. The difference wasn't significant, but it was clinically significant for those individuals. As I mentioned, Mimi Lay, who was part of that original 12-week group, went on to adapt the Mothers and Babies course to an 8- and a 6-week group, also conducting it in a group format with 3 booster sessions in English and Spanish. And most of her work now has been looking at the Mothers and Babies course in immigrant and Latina populations in the DC area. And if you're interested in accessing some of the manuals, that's where the link is for you to access some of the manuals and some of her work. But in terms of the outcome data for that, so in a recent, not a recent, but several years ago, in a study that was conducted looking at the 8-week curriculum, similarly with immigrant Latina populations in a WIC program, they were able to demonstrate that those who were assigned to the Mothers and Babies course had a lower depressive symptoms and fewer cases of moderate depression. as well. And also when looking at the incidence of PPD, it was lower amongst the Latinas who were in the Mothers and Babies course. Our colleague Darius Tandon, who's at Northwestern University and who predominantly works with home visitation programs in that region, as well as in other regions of the United States, adapted the Mothers and Babies course to be delivered as an adjunct to home visitation visits. And so there are two versions. There's a 12-session version as well as a 6-week version to be delivered in group. And really what the Mothers and Babies one-on-one version does is that it adds on content as from the Mothers and Babies full course to each home visitation session, and it's delivered in 15 to 20 minutes. Most recently, it's been further adapted to be 9 sessions and to include some aspects of mindfulness practice within each of those home visitation sessions. If you're interested in exploring some of Darius Tandon's work on the one-on-one, as well as other projects that he's conducting using the Mothers and Babies course, this is the link to his website. It's a really beautiful website with a lot of resources in case you're interested in that. And one of the things that I like to do, because sometimes people will ask like, oh, how is it different? How do you get to deliver all of the content from 12-week group sessions that last 2 hours into 8 or 9 sessions that are only 15 to 20 minutes? And what we often try to highlight that no matter what modality you're using, the core principles typically remain the same. The delivery is just what might be different. And having that flexibility is so key, given that we're all in different settings and different resources in our settings, and especially with the pandemic, different methods of delivering mental health content. So this is just a comparison just to show how the content differs in terms of the delivery, but in terms of the actual content and the constructs that are being delivered, it remains relatively the same. So in the first column, just using the 8-week group as an example, typically delivered in 60 to 90 minutes in a group format. With the pandemic, this has been delivered in a virtual format, but still in a group format. You can see that we always start with an introductory lesson where we're introducing the constructs, the theory, the way that the structure, how we're going to be working together. And then we move on to the actual CBT aspects of the intervention, where we talk about cognitions, behaviors, and relationships. So that's the thoughts, activities, and contacts. And each different modality also concludes with a graduation or review session where we really get to celebrate the individuals who have completed the intervention. And part of our motivation for doing that is that in our original Mothers and Babies course, where we were working with a lot of immigrant Latinas, many of them had not gone to school or had completed a program of any type. And so this was really the first time that they were able to have a completion and a graduation of something. And so we really try to make it a big deal to acknowledge their efforts and their commitment, not just to themselves, but also to creating an environment for their newborn babies. So in our graduation session, we often will review the content that we've covered, cover some of the risk future prevention interventions that they might want to implement from the course, but we also give them certificates to acknowledge the completion of their course and to celebrate them. But if you look at the column, the second and third column where it says one-on-one and one-on-one with meditation, you can see that there is some variability between how and when certain content is presented, but for the most part, it's still consistent across each of the different modalities. There's definitely a really good data coming out of the one-on-one interventions, both when delivered by home visitors as well as lay individuals who are not mental health providers. For the 6-week curriculum that was implemented with predominantly African-American women enrolled in home visitation, they were also able to demonstrate greater reductions in depressive symptoms, both in the short term and in the shorter, longer term. One thing that I want to highlight, and this is currently under reconstruction or being redesigned, is that for the one-on-one intervention, there is a fathers and babies toolkit, and it's complementary to the 12-session. Currently, the current version is complementary to the 12-session one-on-one. This original one was designed for fathers, but really the constructs can apply to any partners who are supporting a perinatal or a birthing individual. And that's why we're updating it now so that it can be more inclusive and reflective of the variability of parenting relationships that we see and the people that are in the newborn baby's life. But the way that this particular version works is that for each construct that is, oops, that went away. For each construct that is, let me see if it'll come back. No. Okay, sorry, I don't know where that went. Some fancy graphics in here. But for the concepts that are presented in the mothers and babies course to the birthing individual, there is a complementary worksheet that's presented for the partner or the father that they can then use to talk and collaborate on some of the constructs that are being learned by the birthing individual and how they might apply to the partner. And I'm just going to go back and forth. There it is again. So this is just the one on the left that has the woman and child in the middle and the circles all filled out. That's what we present in the mothers and babies course. And the image on the right with the male and the baby and the empty circles is the complementary worksheet to go with it. And so in theory, if a partner was involved in this, then we might ask them, what are some of the stressors in your life that might be impacting your relationship with your newborn baby or might be impacting your relationship with your partner? Okay. And then another way that the mothers and babies has been adapted, and this is mostly the work that I've been doing, is through an online intervention. And part of the motivation for doing that was really, again, trying to use the resources that we have accessible to us and to really expand the reach of the mothers and babies course to individuals who are not able to visit a clinic, who maybe don't have resources in their community and so forth. So this is the latest iteration or the second iteration of the mothers and babies online course. This is what the landing page looks like. The current version is closed just because we're updating some of the more technical aspects of it, but you can still go to this website and visit and see some of the content and how we present it to perinatal individuals. In the current iteration or the most recent one that we had active online, we also opened it up to partners as well as family members, friends, and health providers, given that there was some indication that those individuals really wanted to have access also to the mothers and babies course. These are just some of the images of the current version of the online version, which is available in English and in Spanish. And as you can see from here, we have different images as well as videos that explain some of the constructs. Also within the online course, we have different worksheets that individuals can fill out and print and share with their provider should they want to, or return and enter their information in a different way based on constructs that they're learning through the mothers and babies course. In the initial online version, which is based off of the 8-lesson Mothers and Babies course and predominantly included Spanish-speaking pregnant individuals, we weren't able to find a significant difference between the Mothers and Babies course and the control condition, however, which was an information pamphlet. However, what we were able to demonstrate is that those individuals who had the elevated prenatal depressive symptoms and who engaged in the Mothers and Babies course had a lower risk for developing postpartum depression during the follow-up period. And we were also able to demonstrate that those who were in that category also remained depression-free for a longer period of time than those who only accessed the information pamphlet. I then went on to adapt the Mothers and Babies course further to a text messaging platform. And this really was born out of some of the feedback that we received from the original online course, in the sense that not all of our perinatal individuals who were in that study were able to access desktop laptops and whatnot, and also the changing nature of the way that we just access digital tools. We decided to do a text messaging platform because it seemed to have the most widespread access amongst different populations, and giving the emphasis that I have on my work to really try to reach, low income, African American, Latina perinatal individuals. I really wanted to reduce the barriers to them being able to access it. One of the things that I've seen in the populations that I work is that they don't always have access to the latest technology or digital tools. And they also don't always have access to the different platforms that might be needed in order to access these tools. So really trying to use simple technologies as a way to just deliver it to as many people as possible. So the baby text program that I designed, again, it's based on the 8-lesson Mothers and Babies course. It's a fully automated text messaging program where individuals are invited to be part of the baby text program if they're pregnant or postpartum. And the way that it works is that once they enroll in the project, we invite them to attend a Zoom introduction group and a graduation introduction group. And those two groups bookend the actual modules of thoughts, activities, and people, which they receive by text messaging. The initial version of this was fully automated. We adapted it to include some more human interaction in it because we recognize that perinatal individuals are often seeking and wanting to meet other perinatal individuals. And also it provided us an opportunity to really engage and get to know the women who are being part of the study, something that we find to be really critical and important, especially when working with different diverse ethnic and racial and cultural populations. And so we really wanted to be able to meet them and create a sense of community. Individuals who are enrolled in this project do receive the Mothers and Babies course constructs that we have reframed as tips. Because you can only send so many characters for most, in a text message for people to actually engage in it. This particular study, the current version, which uses the Zoom groups, is currently recruiting pregnant and postpartum individuals. We have created a website as well, which I think is on the next slide. Yeah, this is the website, the Spanish version. So if you know any pregnant postpartum individuals who could benefit from receiving some mothers and babies tips for 3 to 6 months, please feel free to refer them there. We screen as part of this study for depression and anxiety. We provide them resources should they endorse different criteria on the depression measures, and we track them up to 3 months after they've completed the intervention. As I mentioned, the original version was fully automated in that participants were able to sign up for the baby text program and receive the tips. We never met them. They simply engaged in it for about 70 days. And every other day they would receive a tip based on the Mothers and Babies course, along with different mood ratings, which is a core aspect of the Mothers and Babies course. And for those who reported elevated mood, in terms of depression or anxiety, we would refer them to the PSI warm line. We also assessed through this initial study, which was more of a feasibility and acceptability study, what they thought about the different messages. We did still include pre-post PHQ-4 items in the study as a secondary emphasis, as a way to assess whether the intervention had any impact on their mood. So the PHQ-4 is the 2 items, depression for the PHQ-9, and the 2 items from the GAD-7 on anxiety. And then we conducted some post-intervention interviews. And what we found, it was a really small sample of individuals, diverse individuals. What we found is that even when not really aiming, at least in this particular study, to look at depression and anxiety outcomes, receiving some of the text message tips did seem to either keep depression at the same level or improve the anxiety levels by lowering at the post-intervention. We also asked participants what they thought of the different messaging as a way to begin to change or modify the messages that were being sent so that they more accurately represented some of the content or some of the distress that some of our moms were experiencing. And for the most part, they found the messages to be quite helpful. There weren't really that many that they thought were not helpful at all, that they thought we should get rid of, although there was one that they didn't really like. And so we've gotten rid of that one and have continued to improve the types of messages that we send. But you can see here on the far right column an example of what the messages might be, and in the somewhat middle column, the themes based on their feedback. So in summary, when thinking about the Mothers and Babies course, there are a number of ways that it has been adapted. We continue to hear and be invited to be part of different agency implementation practices around how do you adapt the intervention to your particular population. We definitely encourage it. We also encourage that if you are going to be implementing it, that you engage in some formal implementation evaluation of the intervention. That is something that I'm happy to work with any agency should that be of interest of yours. And we're always looking for different ways to integrate and adapt it to systems of care. In terms of the research, definitely several studies have shown that it is effective at preventing the onset of postpartum depression. And in fact, in 2019, the US Preventive Services Task Force did a systematic review of different prevention interventions for postpartum depression. And the Mothers and Babies course was recommended by them, along with the ROSE program, as an intervention that had the most evidence to reduce the incidence of postpartum depression, and made the recommendation that it should be recommended to high-risk pregnant individuals as a source to reduce their suffering and distress associated with postpartum depression. So that has been a really positive outcome of the Mothers and Babies course, in the sense that we were able to begin to share with more agencies, to train more providers around how to implement the Mothers and Babies course, so that more perinatal individuals are able to reduce the depression, anxiety, and stress associated with the maternal experience. So I'm going to stop share there. I see that there's a number next to the chat. I don't know if there's anything that stands out, David, or if I should just read through and answer.
No, I think the one from Eileen would be a great place to start around whether there are national home visitation programs using this curriculum.
Yeah, so we are currently working, the one that I know of, I'm working with Darius Tandon with the Parents as Teachers organization, and that is definitely, they have already been implementing it. I know that there's a lot of agencies within the Parents as Teachers network, and that is something that we're going to begin doing in the coming weeks, I think, where we're going to be working with different agencies. So the short answer is yes. To that, I think, Darius Tandon has been excellent at really reaching out to a lot of the national organizations on home visitation to really begin to implement the Mothers and Babies course. And, offline, if you want, I can connect you with him if you're part of any one of these home visitation programs and really want to begin to implement it. But we've seen some pretty good success in terms of the implementation of that for the Mothers and Babies. Okay. The text option, just looking at your comment, Heather, thank you, has been really great. It's been a really non-invasive way for birthing individuals to add mental health to their day-to-day. Also, because of the nature of just receiving text, one of the ways that I think of my use of technology to deliver the Mothers and Babies course is that there's still so much stigma associated with mental health in general, and in particular, with maternal mental health, and then even more so within some of our more diverse communities, where your identity as an individual might be closely tied to your identity as a birthing individual. And so, by virtue, because, technology is so ubiquitous, looking at your phone, looking up something online is not that unusual. It's very different than going to a clinic that says, psychiatric services, enter here, right? So you can begin to receive and get information around mental health simply by the tools that you already have accessible to you. So I really think of technology as a way to reduce stigma and to break down those barriers that come up for accessing mental health. And we've heard a lot of our moms in the projects that I've worked with that it's just been really nice just to have something really accessible to them. And in addition to that, a reminder when they're deep into being a new mom, that their mental health matters. And that how they're doing is important as well. So that's some of the feedback we've received from the text messaging programs. So to Stephanie's question, recently had increase in teen young moms. Yes, for sure. It's so whether teens and younger moms might benefit from the baby text. They're definitely not often answering phones. I have a teen myself and I know never answers the phone. But yes, I think this is something that can be easily rolled out and delivered without additional barriers or the need to have a conversation. I think that is one of the things that we're working on now. And as part of one of the projects that I'm working on is that we're really trying to think of different ways to bring it to our adolescent moms. To really provide them resources so that should they, so that they're both educated about maternal mental health, but then also have an avenue for seeking more acute care should they need it during the pregnancy and the postpartum period. Yeah, there are some members of our team that have worked some with pediatric practice. I definitely have a strong feeling that that's another missed opportunity for us as mental health providers, especially around the maternal mental health period, because once, as you all know, once a birthing individual, has given birth and the baby's healthy, they move on to the pediatrics department or to their pediatrician. And it's the pediatrician who really is seeing the birthing individual, the mom, on, initially very often, and then every few months, or when the child becomes sick, or every year. So they're really the ones that are seeing how our moms are doing once they're out of sort of the care of the OB. And that's definitely a place where if we could provide our pediatricians with more training and knowledge and resources, that they could hopefully begin to help close the gap or bridge that gap, as you put it, Heather, for our perinatal individuals who are no longer perhaps as much under the care of a health provider who might be able to target or see that, they need more support. So I would love to do that. And feel free to back channel me if that's something that you would be interested in, developing or exploring a little bit more. So with that, feel free to put any other questions in the chat. David and I are going to switch roles, and I'm going to hand it over to David, who's going to share one implementation of the Mothers and Babies course, which I'm really excited about.
All right. Thank you, Elaine. Can you see my screen?
We can, yes, much better. You just moved one of those blocks.
That black bar is still there,
yeah.
right?
Yeah, but it's not covering your slides. So
it's not covering the slides anymore. Perfect. All right. Well, thanks again. And we're really lucky to have you as an advisor, and just want to thank you from all of us at MOL, really everybody at the conference, just for all the incredibly rigorous work that you and your colleagues have put into this program. So let me try and do a bit of a transition here. So what is MOL? It came out of the conversations that I've been having with my wife, or was having with my wife, my sister, and my mother-in-law, who, by the way, are all OBGYNs, and with my co-founder, Viraj Parikh, who some of you may have seen present yesterday. So through these conversations and over the last couple of years, we created a platform that combines traditional birth education with mental health focused support and guidance. So, and that's where the Mothers and Babies course comes into play. But our aim is to really proactively prevent and reduce symptoms of perinatal mental health conditions. And ultimately, we believe that this program that we've created can actually be used as an early intervention tool during pregnancy and into the postpartum period. So with the help of Dr. Barrera and really primarily through the work of my co-founder, Viraj, we've integrated the Mothers and Babies course into our platform so that pregnant and postpartum people, especially those who screen at risk for a perinatal mood and anxiety disorder, for those individuals to actually utilize Mothers and Babies and really engage with Mothers and Babies as part of their experience within the MOL program. I'll talk a little bit more over the next several slides about how this is actually working in practice, and how it's working with our current partners. And I'll give you some context of how the actual Mothers and Babies course, which Elaine or Dr. Barrera just talked about, how that fits into our program, and also actually show you the adaptations that we've made to ensure that the Mothers and Babies piece actually can continue to evolve to meet users where they are. And that is, mobile, on demand, really AirPods, headphones, while you're breastfeeding, while you're doing the dishes. So I'll jump into that over the next several slides. So as I said, I'm going to talk about, in fact, this is a slide where I talk about how this actually works today with our partners. So this is a model of the current referral pathway. So I think a lot of the folks that are here, attending this conference are well aware of this, but this is really what happens after screening at the OB provider's office. So at the top end of this slide, we see those patients who screen really answer the EPDS as that question 10 as being suicidal. And at the bottom of the screen, we've got those that are no risk. And so we think that, and what we've seen in practice is that providers really at that extreme, at the two ends of that risk stratification, are doing a great job of either referring to to inpatient care on that most extreme stratification, and also providing medication or even a direct referral into a therapy appointment at those two highest levels of risk. Where we are at MOL, where we're most focused with our current partners is in this mild to moderate risk range. And again, that's as defined by the EPDS score. So one of our major pilot partners is actually Penn Medicine. And the way that it's working at Penn is that Penn is already doing a great job of screening their patients. 100% of the practices, outpatient OB practices at Penn, are doing EPDS scores at least one time during that prenatal period. And so for us, because Penn is already screening patients, they're a great partner for us, because what happens then is that if these patients score in that mild to moderate range, they're sent a text message, and they're advised that as a Penn patient, they can actually enroll for free into the MOL digital program. And so this program, and I'm going to move to this next slide, actually includes the following. And I'll go through each of these pieces of this wheel of MOL programming over the next 3 slides. But these include support, guidance, and education. So let me jump into support first. So MOL includes unlimited access to a maternal coach, and this maternal coach can then escalate the patient to support groups and psychotherapy as needed. Second, the guidance piece, right? So our app, the MOL app, is a central hub for the program, and that includes text messaging, screening, I guess additional screening beyond what is already done at the OB practice, and tools including a postpartum care plan creation program and interactive checklists for patients based on their gestational age. Finally, and this is why we're here, the education piece, right? So support, guidance, and education are the 3 pillars of the MOL digital program. And within education, we have 2 major pieces. Number 1 is our curriculum of 10 primarily traditional birth and postpartum education webinars. Those are available on demand and live once a week on average. And again, most importantly for this conversation, the Mothers and Babies course. And this course, I'm actually going to show a 5-minute demo video on this next slide. It's literally going to be, it's actually my partner Viraj's cell phone, and we just did a screen record on our cell phones, or on her cell phone, which is a new function that we learned about recently. And I'll actually kind of narrate a little bit, but we wanted to show you, just do a little bit of a virtual demo of what this actually looks like on a patient's cell phone. So let me hit play here. All right. So this is the hamburger menu inside of the app. And she's now clicked Access Mothers and Babies course. By the way, as part of the program, you always have access to clicking that button, but you're also given it over time, and with your coach, you're given multiple nudges to actually jump into the program. So she clicks Get Started. Because she's already enrolled, she's seeing this enroll, that little message that says she's already enrolled. But if you weren't enrolled prior, you would get a couple of quick questions to enroll yourself in. So we start with a pre-course assessment. And let's see, I think we're just kind of showing you all the different modules of the Mothers and Babies course, but we would start with this pre-course assessment. And many of you on this Zoom would will recognize what this pre-course assessment actually is. It's the EPDS. But we try to make it very easily, clickable. You just kind of click and then it moves you right along to the next question. And we don't actually go through all 10 questions here, but we wanted to just highlight how quick and easy it is. Then we move on to what comes next, right? So after you finish each piece of the course, it actually immediately just pulls you right up.
Hi, welcome to the Mothers and Babies course at MOL. This course was designed in collaboration.
And so it'll keep going. It was designed in collaboration with Dr. Barrera and her colleagues. And I'm going to actually
Maternal mental health disorder
here for a second. So you'll see that actually each of these videos is narrated, and there's also slides. But one of the things that we got out of feedback from our population, the folks that we're working with, is that we don't always have time to look at our phone, right? So this goes back to the AirPods and doing the dishes, or AirPods and nursing things. So we made sure that the actual narration, while it's great to have narration and the reinforcement of actually watching the slides, we made sure that the narration would stand alone. And so our app actually, even after if your phone screen turns off while you're listening or while you're watching, it'll continue to play in the background, and the narration will stand alone or stand on its own, with or without the slides. So let me keep going here.
include a range of conditions and symptoms.
All right. And so we're going to skip quickly through the rest of Module 1. But what you'll next see is that I talked a little bit about reinforcing, right? Like the reinforcement of...
Welcome back to Module 1 of the Mothers and Babies course at MOL. The second topic in this module is harmful and helpful thoughts.
And so as you finish the module, I think now we'll skip quickly through the module. You'll get some exercises that follow the videos, but MOL will know when you've finished Module 1, and it'll automatically send you a text message. And each of our text message, or many of the text messages, are actually interactive. And you'll see the one that will be given to, that will be sent to Viraja's cell phone here after she's finished Module 1, will actually
welcome back to Module 1 of the Mothers and Babies course at MOL.
All the videos. Let me skip that quickly. So now we've finished. She gets the text messages because we know that she's finished Module 1. And you'll note that in this text message, there's a link that you can click. Let's see. Maybe in this one, there wasn't a link, but it will pull you into, or maybe there wasn't, it was a little further up, but it'll pull you into the quick mood scale, which is, as Dr. Barrera mentioned, one of the core pieces of the Mothers and Babies course. And so we'll be tracking the mood of our patients, over the course of their interaction with not just MOL, but also the Mothers and Babies course specifically. I'm not going to show you much else after this because I think you kind of get the picture, but also because anybody can go to mol.com and download the Mothers and Babies course and enroll.
Comfortable place for yourself to sit.
One of the other pieces in the Mothers and Babies course is also the meditations, which are actually wonderful. It's part of the sequence of the Mothers and Babies course, but it's also something that you can access at any time. And then afterwards, actually, I can show this quickly. Similar to, the I guess Mothers and Babies Classic, we end with a post Oh, actually that video disappeared, but we do also end with a post-course assessment. And after you finish that post-course assessment, you will receive a final certificate of completion. And again, we offer the mothers and babies piece of the MOL platform, that a la carte piece, for free to anybody who wants to just come and enroll themselves into the mothers and babies course. So I encourage anyone who's interested in either learning more about it for themselves or learning more about it on behalf of their patients or their community, come check out the program, enroll, poke around, ask questions, to Viraj or I. Our goal this year, and I always have to end as like the business guy on the team, I have to end with an ask, but our goal this year is really simple. We just want to get the program into the hands of more patients. Specifically, we want to triple our pilot partnerships and continue to enable the easy, free access to our program. So that's why, in the meantime, like I already said, individuals can enroll into the mothers and babies piece of the program. They can enroll into really any of our services a la carte, many of which are free. And for those that aren't free, you can come to our booth. We're giving 50% off coupons, and we're always open to collaboration and setting up, partnerships where we can offer, our work, our program to your patient population for free. Our goal is to really get this into the hands of patients, show that it's working, and then ultimately expand from there. So I am done with my piece of the presentation, but I'd love to take on any questions if there are any.
And I put in the chat the MOL website in case you want to explore it some more, as well as the links to the locations where you can download the Mothers and Babies course manuals, which are also for free, and then the digital versions of the Mothers and Babies course links as well. And I will also put in the chat just our contact information. If you're a little bit Zoom shy or not ready to present yourselves, please reach out to us. I think I speak for David and Viraj and myself that we're all interested in collaborating and partnering with you and sharing the resources that we've developed, not just the Mothers and Babies course, but other resources like the full MOL and other things that we may be working on. Are there any other questions or comments that our group has? You might put those in the chat, or feel free to unmute yourself and share it with the rest of us.
Yeah.
Hi, I'm Loretta Calloway, and I work for Solano County, and I've been implementing the Mothers and Babies curriculum, and I think this is awesome. We did follow you before when you had the online, and I did refer clients to that.
Yes.
And so I'm excited about this opportunity, especially for mild to moderate moms.
Mm-hmm.
And so definitely want to possibly offer this to some of our participants. And so could they just go online? Is that how we do to make a referral versus a MOU and a partnership, but just to be able to refer them directly to, and is it considered a research study or when they log on?
With MOL, no, you can just come right to MOL. It's not considered a research study. I mean, if you want to do research and if you want to show outcomes, then I would suggest that you and I talk and think about the the endpoints that you're looking for, and we'd be happy to support that. But if you want to just start by referring people to our to our website, and I'll reach out afterwards actually just to make sure that you get the exact URL, exactly where to start. It's relatively self-explanatory once you get to the site, but I think, it would be nice to collaborate more formally at some point, but certainly start by just sending people over, let them try it out. If you get great feedback, then, then we all are happy.
Yes, yes. I love it. It's another great resource because sometimes I love the component about having the narration going so that they can listen to it, so they may not always be able to do the visual piece. And I know we actually tried to recently implement our group model, but because there's so many competing areas for moms to be on a call or a Zoom call for a long period of time is really difficult. But to have this option is awesome. And one thing that we have done is the model for mothers and babies, the one-on-one, the 9-week one. I'm actually a social worker, and work with home visiting programs. And so I actually work with the moms one-on-one in doing the mothers and babies piece versus
Great.
adding it to the home visiting um,
Yeah.
um, participant or staff. I actually just do the one-on-one myself and do the 9-week model. So I was definitely interested in learning and how we can continue to do, because it's so a great model, mothers and babies, and it's so simple, really, when you present it to families and they really understand it. So I'm excited for this. Yay!
Yeah.
And so
That's
I'm gonna
awesome.
check it out for myself too, and be able to just be able to refer. And I missed part of it. I got on the call later, but I missed part of it. So, um, if emergencies come up or if there's distressing situation, are they referred to a licensed clinical social worker or suicide prevention, or how's that happen if they have any, or if their score is really high, or when they take the Edinburgh? How's that handled in the
Oh, is
app?
that, I
Yeah,
guess I
in
can
the app.
answer what
In the app.
happens within
Yes.
MOL. Sure.
Mhm.
So we get an alert anytime anybody takes the EPDS.
Okay.
And then in addition to that, like there's kind of, it becomes like a red alert if, if it's at that, more extreme risk case. And then we'll escalate to, if it's a member, if it's someone that's in the program, right, actually enrolled in the overall MOL program, right? Because remember, the mothers and babies piece is part of the overall program.
Okay.
If it's someone that's if it's someone that's enrolled in the MOL program, we'll already know who their physician is or OB provider is. And we would likely either escalate to the OB provider, or if it's, suicidal, then we would escalate to, the PSI, or I guess that, no, the warm line, it would be not
Oh,
not
PSI.
yeah,
Postpartum
but
support
we would
international.
escalate to the right place there.
Yeah.
But we
Okay.
always know exactly when someone takes it, and we get like an alert right to our phones that says, this is somebody that has scored in that higher risk range.
And we do
Great.
something similar in the baby text program. So if during our onboarding, someone indicates an elevated depression score or endorses, and we have a couple suicidal ideation questions embedded in the study, we provide them resources immediately and follow up with a phone call and provide them resources, many of which come from PSI. And we do full risk assessment if during one of our phone calls they continue to endorse any suicidal risk, and we continue to follow them and refer them out. And then our text messaging platform is quite sensitive to picking up any potential risk words, even words within a word. So for example, we had one participant text back something along the lines of, I'm looking forward to changing how I do things. And so our text messaging system is so sensitive that it picked up hang in the word change. Right. So
Yeah.
so we, it gave us an alert immediately. Once we looked at the message, we didn't have to do anything after that. We're like, oh, it's hang within another word. This is a positive text message, but it's so sensitive that it alerts us right away. And several of us, it alerts us to inquire further.
Is it up and running, your baby text message? Because at one point I was going to refer, but it wasn't working. But it's operational now. Or?
Yes, the baby text study. We have a website called babytextstudy.com. And it's available in English and Spanish. And there are, there's information on the website, and through that website, they can connect to the project. And we do all of it because of the pandemic. All of the screening is online. And then we communicate with them either through text messaging, phone calls, or for those who provide their email, we'll reach out to them over email as well.
Great. Well, thank you so much. I appreciate the additional services that we can offer our families to meet their vast needs, right? So not just always one-on-one in person, but to be able to meet everyone's needs. So thank you
Yeah.
guys.
And just to add on to you using the one-on-one is a great way to begin to integrate it into the additional other services that you're already providing. Obviously for each of the group sessions, there's a lot of content. Even an hour is sometimes not enough, especially if you have several participants in the group. But the one-on-one content has really been distilled down to 15 to 20 minutes. And I'm even currently working with a team that has taken it down even to 5-minute videos that have been created as a way to enhance some parenting skills that the parents are learning about, to enhance that, because we are continuing to see depression and anxiety in our parents, which I think is no surprise to many of us. And so the one-on-one is a really great way to stay consistent with the core constructs and the key concepts that we want to teach, while also still doing all the other things that you all do in home visitations, which I know is a lot to cover usually.
It is. I find actually it's longer. I'm like 40, 50 minutes because
Yes.
I'm just focused on that, and it's not added to the home visitors additional duties. And so that's just a way that you could get creative with it if agencies want to do that, to have a designated mental health professional to do that part of mothers and babies. So, so.
For sure. Well, thank you, Loretta. Thank you. There were a couple of questions in the chat. One was from Celeste Poe. Hi, Celeste. And the question is around whether the mothers and babies can be adapted for unique postpartum experiences such as NICU parents. And most definitely, I mean, I think that there have been other adaptations for different populations based on their current living situation, family planning, all of those things. It's just a matter of thinking about how the constructs are presented, just how, one of the things I often say in trainings, that what we teach in the mothers and babies course is not so much groundbreaking. It's CBT principles, social learning theory, and whatnot. It's really about the framing and the presentation that kind of informs the adaptation. So most definitely, and if that's something that you'd be interested in pursuing, I'd be more than happy to work with you on that. I often in trainings will begin to adapt it for the people that are part of the training. So one of the things that I love to do, it's one of my favorite things to do with the mothers and babies course, is to really think about how could this intervention be implemented and adapted to the communities that you're serving. Because as clinicians, I almost always have to adapt to what I'm doing clinically, even if I'm following a particular theoretical orientation. But it's really about what are the needs of the client that's, that we're serving, what are the things that we need to consider, both situationally and living situations, health, culturally, and so forth. So definitely can be adapted. And I'd love to explore that further if you're interested. And then Marcia had a question around whether the text messages, I believe at least, are being informed by the mother's feedback, and most definitely they are. We've received a number of comments around feedback or text messages that have been helpful for them, the types of messaging that they would like to see more of, the types of messages that are definitely not helpful. They are not shy about sharing with us, and we're so glad that they're not shy about it. Because we don't want to be delivering things that, don't make sense to them. And then also, when they're comfortable and when they're willing, we ask them to share how something could be worded differently, or what other ways might we present some of the constructs. Part of the challenge with that is just that we really want to adhere to the theoretical principles that make the mothers and babies evidence-based, but we definitely want it to be reflective of what they need in their feedback. So we definitely do that. And David, I'm not sure if in the MOL version of the mothers and babies, at least the text messages that they receive, if some of those were informed by them as well.
Yeah.
Great.
And constantly evolving, right?
Yes, constantly evolving.
Yeah, and part of the beauty of being a startup, right, versus research driven and as more academic, is that, like, if a few people say that is a terrible text message, take it out, and hopefully we don't have any more terrible text messages.
Definitely. And one of the fun things too, I think, for at least the text messaging project, is that we really want it to be a low burden for our participants. And so we don't often ask them to provide feedback, but sometimes we do, because we do want to know, if they're implementing the skills that we're teaching, how their mood is going. But we often receive messages, really probably just thinking out loud, things that they respond to organically, which is a really lovely way to get their input. And that's always really nice as well. Marsha, yes, being a startup makes your organic always healthier. That's great. Any other thoughts or questions or reflections? No? Well, we've put our contact information in the chat. I think I speak for David and I that please reach out to us. We love talking to other people about the products and the resources that we've created. We've only just barely touched the surface of the mothers and babies here, just sort of an overview. But if you're interested in learning more about the mothers and babies, please reach out to me. There's definitely a lot more content into learning it, and a lot of resources if you want to go dive a little bit deeper into what it is, how to implement it, and also how it might fit in your communities of care.
Thank you, everyone. We'll see you at the rest of the conference.
Yeah, thank you. Enjoy.
Bye.
Bye, everyone.